Why do you feel the Surgeon General is so worried about mental health in the military?
Well, I think what he was concerned about was that the cuts being requested for the health services were unfair and that they would have a profound impact on the offering of the kind of services. His concern was that the health services group had not gotten the advantage of the growth that had taken place in other aspects of the military, yet they were being asked to cut basically on a 10% basis without concern about the effects on the service.
What do you make of the statements by the Conservatives then saying that the amount of mental health money and resources has been increased over the years?
Well, they've increased over the years, but that doesn't mean that that every dollar is not needed. The question is whether they should be subject to this full 10% cut that was being pushed on them. The Surgeon General, whose job it is to keep an eye out for the concerns about healthcare services, objected. He objected strongly. He had to go directly to the Vice CDS and the CDS in order to get some changes made. That's how concerned he was. What's happening here, of course, is that Treasury Board is insisting on 10% cuts. I don't think they looked seriously at what Lieutenant General Andrew Leslie said a year ago in his transformation report. He looked at significant savings that could be made in various areas. Well, instead of doing that and looking at that particular type of saving, they just did an across-the-board cut. The across-the-board cut obviously cut across healthcare services as well as everything else. And he thought that was wrong. We agree.
So it's not necessarily a lack of funds as much as it's the mismanagement of those cuts?
Well, it's a question of where they're going to make cuts. I mean, if General Leslie is saying we got significant dollars available to be saved at National Defense Headquarters through contractors, which are basically individuals being hired through a personal services contract. If they're not even employees, and he said that substantial savings could be made there. Instead of going to those places where the cuts could have been made, they've imposed an across-the-board 10% cut on every department and every aspect of it. That's where it's unfair, because it turns out being arbitrary and impacts the healthcare services to the point where the Surgeon General said that these would have a profound impact on the ability to provide medical services. That's clearly an indication from the guy who's in charge of providing health services for the military. For him to say that, that's a clear signal that the approach that the government has taken is totally